Today, today we are going to talk about comma definition. Okay, in this video we are just going to look at only definition of comma. In the next lectures, I am gonna talk about other parts of the comma like management or causes, nursing management. Okay, so I am going to talk about all those things in next videos. In this video, I will just talk about definition of comma. So comma is derived from the Greek coma, which means deep sleep. Yeah, deep sleep. Coma has been defined as absence of any psychologically understandable response to external stimuli or inner need. It means that it means it is uh, deep sleep. It has been derived from the Greek word that is coma, which means deep sleep. Okay, deep sleep, and it is an absence of psychologically understandable response, which means patient this patient is unable to respond to external stimuli. Yes, external stimuli like touch, smell. Okay, touch, smells, or hearing. So he is unable to respond to all these external stimuli because he is in coma condition or state. Okay, it is defined as the absence of any psychologically understandable response to external stimuli or inner need. We can understand inner need like hunger, thirst. So he's also not able to respond to his inner need like hunger, thirst. Okay, we have one more definition, or you can write one more definition if you want. Okay, you can write one of this definition if you want to write in terms of comma. So unconscious or unconsciousness or coma is defined as the state in which a patient is completely unaware of the self and external surroundings meaningfully to external stimuli. So it is also the same definition like this one. Patient is unable patient. So what is this? It is a state. It is a state, comma. It is a state in which patient is completely unaware. Patient is completely unaware of both things. Patient is completely unaware of both things. First is self and external surrounding. Self surrounding means, or external surrounding. External surrounding. Self means again hunger, thirst, thirst. Okay, and external means like touch, hearing. Okay, all these surroundings or sound. Okay, and he is unable to respond to meaningfully to an external stimuli. So external stimuli again same, touch, smell and sound. So he is unable to respond to external stimuli like touch, smell, hunger, sight or other things. Okay, so it is a state in which patient is unable to react with two things, self surrounding and external surrounding, that is hunger and thirst. External surrounding means touch, hearing, sound. Okay, and unable to respond to meaningfully to an external surrounding. So you can write one of these two definitions in your exam if you want to write. Okay, both are correct. So in next lecture I will talk about causes and management, signs and symptoms, okay, other things and so on. So I will meet you in next lectures. Bye bye for now.